Hi, this is Marcus with All American Health. We are a non-emergency medical transportation company. We provide consulting services in the non-emergency medical transportation industry and also digital marketing to healthcare facilities and all things medical services. Uh, Today, I want to talk with you guys about providing transportation services to rural areas. I did a video earlier about rural transportation versus metropolitan transportation and some of the advantages. If you're providing transportation services in rural areas, your contracts can become very lucrative. If you have a facility 15, 20 miles outside of the main city or metropolitan area, that's considered a rural area. A lot of those consumers will likely need to go into town to receive services from their healthcare doctors and their primary care physicians, or in a lot of cases, they're the specialists. And the way you set up a contract with a rural area company versus a in-city or metropolitan area facility comes with some level of adjustment. Some of the things that you want to consider are your dead miles. If you don't know what dead miles are, or is the mileage between where you're at versus where the consumer is located. Those are considered dead miles. There's no one receiving services in that area. That's the cost of you getting to that client and taking them to the appointment. If you find a facility that has a need, that has a pain that you can relieve, a solution that you can come up with, usually solutions come with a certain type of fee. If you take Uber and Lyft, for example, they have something called a processing fee. Airbnb has a cleaning fee. That's just included in the service that they're providing. And really, it's not a service, it's a solution that they're providing. You're providing a solution to the problem that rural rehab facility has. Say another company was supposed to come pick up one of their clients. They're contracted through a broker, and that particular company never comes and picks that client up. But you're available to pick them up on a short notice. You want to make sure that you're including in your service, a part of that service are your deadhead miles. If you're going 20 miles in one direction to pick a client up, you're still putting wear and tear on your vehicle. It's taking time out of your day to transport that individual. That's, a 20-mile trip is going to take you 40 minutes to get there. How many clients could you have transported in the city in that 40-minute window? So you're losing money, so someone has to cover that fee. So if your contracted rate is 0 to 10 miles, and I'm going to give a round number, 0 to 10 miles in the city is $10 for a one-way trip, which you shouldn't be charging that, but I'm just making round numbers. If you're doing a trip for a rural city that's 20 miles away, that same trip, 0 to 10 miles, they're basing it off of where that facility's at, and then in town, you're probably going to have to charge them, 1.5 to 2 times the amount. So your rate should be somewhere for the same trip for that rural client, somewhere around $17 to $20. And once you break it down to them that you have to make a driver available, send them all the way out there and bring them in, 9 times out of 10, admins, they're understanding of it. And to be honest with you, most admins don't care. Their job is to make sure that that individual is receiving proper health services. And then part of that is making sure that they make it to their appointment. So if that's the case, they don't care how much it costs. And your services are a lot cheaper than sending an ambulance out to get this individual. So, whatever you're charging is fine. But don't sell yourself short by saying, well, I just want to make sure I get the contract. I don't care how far I have to go to get them. You're the only one that feels that way. And you keep having that attitude, you're likely going to go out of business very quickly. So, just a little nugget and a good idea when providing services to rural areas. You have to understand that the cost to provide services in that rural area is a little higher than providing services when, all of your clients are within a 5-mile radius. If you're having to travel 20, 25 miles to pick someone up and then bring them back into town, you want that rolled into your contract agreement, or don't take the trip because you're going to actually lose money. Bye, guys.